So this is what I thought would be helpful for people to comment on, either, and just pick from any of these three things that I sent out via email.
I'm grateful that the OHA allowed us to take this from you. It's wonderful. I think it would be great for our hospital to have something like this. We do an employee engagement survey every year. And on our recent survey, employees specifically asked for more resources and help with resiliency and stress management, mental health. So this would be perfect, I think, for our employees. It was excellent. And I think this is exactly what our employees meant, clinical and non-clinical, because I'm the wellness manager. I think this is exactly the kind of thing that they're asking for.
And I really think that it was just very helpful to hear from other people, their perspective as they were going through the program. And I feel like this is an important thing to be focusing on. I'm actually our fellowship wellness chief, and I feel very strongly about preventing burnout for providers. And I think that we are incredibly busy and often don't have time to think about these things. And so just kind of learning to live in the moment, to slow down, to kind of learn how to process what we're going through during residency and fellowship and in our training and practice later, I think is really important. And I honestly think that this could be incorporated into really all levels of training. So even starting as soon as intern year, residency, I think that there could be a lot of benefit kind of as people are going through training, going through this program too. So I think really all levels of being in general, but I think particularly in the medical field, I think this would be really helpful for even trainees also.
I was thinking of the question that revolved around ROI, and I was kind of playing around with that a little bit, and I kind of thought of it as an ROM, and not just a return on mindfulness, but really a return on me. And and that's what the takeaway was for this training, was it allows me to to be the best version of myself. And in turn, allows me to add value to the others that I interact with as well. Probably just about everybody that has participated has gone through years and years and years of higher education. And this is something that you don't receive in those curriculums. Mm-hmm. And these tips that you shared are just tools that we can put into our toolbox to not only to improve healthcare, but self-care as well.
Thank you. My goal is to disseminate this through Ohio Hospital Association, and so I hope we can make this bigger. And I just think every healthcare worker, and as I said before, I believe everyone who works in the health system is a healthcare professional, because we all impact patient care, even if we are impacting the people that work with patients. And so I just think everybody deserves the opportunity to attend to why they're doing what they're doing.